Hi everyone, we are the group 4 and today we'll be talking about glaucoma. What is glaucoma? Glaucoma is the increased intraocular pressure as a result of inadequate drainage of the aqueous humor from the canal of Schlemm or an overproduction of the aqueous humor. This condition can cause blindness and damage the optic nerve. So what are the types of glaucoma? First, we have the acute closed angle or narrow angle glaucoma. It results from the obstruction to outflow of aqueous humor. Secondly, we have the chronic closed angle glaucoma, which comes from a result of untreated attack of the acute closed angle glaucoma. Thirdly, we have the chronic open angle glaucoma. It results from overproduction or obstruction to the outflow of an aqueous humor. Second to the last, we have the acute glaucoma, which has a rapid onset of intraocular pressure greater than 50 to 70 millimeter mercury. And lastly, we have the chronic glaucoma, which is a slow, progressive, gradual onset of intraocular pressure greater than 30 to 50 millimeter mercury. Symptoms of glaucoma. First, we have the severe eye and head pain. Second, we have nausea and vomiting. Third, sudden onset of visual disturbance, often in low light. Fourthly, blurred vision. Another one, halos around lights. And lastly, reddening of the eye.
So now we are going to start about the assessment of glaucoma. Now let's look at the following symptoms of glaucoma. Number 1, progressive loss of peripheral vision, followed by the loss of central vision. And number 2, we have elevated intraocular pressure, and the normal pressure is 10 to 21 mmHg. Number 3, vision worsening in the evening with difficult adjusting to dark rooms. That means they tend not to see, maybe quite in the evening or night. And number 4, blurred vision. Number 5, halos around white light. Number 6, frontal headache. Number 7, eye pain. Number 8, photophobia. Number 9, lacrimination. And number 10, progressive loss of central vision. So now we are going to be talking about implementation for the acute glaucoma. What can you do for a patient suffering from acute glaucoma? So number 1, you have to treat with as like a medical emergency. You have to treat as something that's very emergent. Then number 2, you have to administer medication as prescribed by the doctor to decrease the intraocular pressure. Then number 3, we have to prepare the client for peripheral endectomy, which allows the aqueous humor to flow from the posterior to the anterior chamber.
So the second topic that we are going to discuss is all about otosclerosis. Otosclerosis is the abnormal growth of bone in the middle ear. This bone prevents structures within the ear from working properly and causes hearing loss. For some people with otosclerosis, the hearing loss may become severe. So there are signs and symptoms of otosclerosis. The main symptom of otosclerosis is hearing loss. At first, you may notice that you can't hear low-pitched sound or people whispering. Next is dizziness or balance problem. And the last one is the tinnitus or ringing or roaring or hissing in your eyes. So the causes of otosclerosis is unknown, although it is thought to have a family tendency or may be hereditary.
For the management of the otosclerosis, we have the medical therapy and the surgical therapy. First, for the medical therapy, as with conductive hearing losses of adult etiologies, hearing aids are usually helpful. Fluoride supplementation has met with variable responses and is used sporadically of labyrinthine otosclerosis. It has also been used for post-operative medical management of obliterative otosclerosis. For the assessment of otosclerosis, number 1, we have the slowly progressing conductive hearing loss. Number 2, bilateral hearing loss. Number 3, a ringing or roaring type of constant tinnitus. 4, loud sounds heard in the ear when chewing. 5, pinkish discoloration, or they call it the Schwarzschild sign. It is the tympanic membrane which indicates vascular changes within the ear. 7, negative Rhine test. And lastly, Weber test shows lateralization of sound, the ear with the most conductive hearing. For the surgical therapy, it approaches to surgical management of otosclerosis include total stapedectomy, partial stapedectomy, and stapedectomy. Hearing improvement can be achieved through surgery for congenital stapes, footplate ankylosis with a concomitant ossicular chain anomaly. Finally, final hearing levels after surgery can be influenced by sensorineural impairment.